the abdomen. So we're talking about mesenteric injuries, okay? And I think this video will serve like a cap to the abdominal injuries that we have been talking about. So there's a concept of what mesenteric injuries, and this concept of mesenteric injuries is simply there's an injury to the mesentery. Now, looking at the mesentery, you have the small intestines, you have the large intestine. The mesentery is here. Now, the mesentery is kind of like it's trying to now what? Can you see this is a mesentery? The mesentery is like a cloth trying to attach the intestines to the back of the abdomen for stability. All right. So if there could be an injury to this place, there could be trauma, or probably there's a cut in the blood supply leading to ischemia and all the stuff, right? So we'll just have an overview of everything I need to know about what mesenteric injuries, okay? So mesenteric injuries, simple, same thing, all right? So mesenteric injuries actually refer to the damage to the mesentery, which is the fold of or tissue that attaches the intestines to the back of the abdominal wall, all right? And the mesentery has innate mesentery vessels and the nerves, okay? So it's these mesentery vessels and nerves that what will now be supplying the intestines to make the intestines be alive. So now you see that when there's a thrombus or there's a blockage in the blood supply, you can see that this side is becoming pale, meaning that side is dying off, okay? So mesenteric injuries are actually a thing, all right? They're actually so much important to know about because they could have so many complications, right? Like let me say the abdomen is no longer motile, it's not moving, it's not absorbing, and you know all those complications, right? So types of mesenteric injuries now, it could be due to lacerations, like there's a cut in the mesentery. It could be due to tears. It could be due to what mesenteric avulsions. It could be due to what hematomas. That's what accumulation of blood in the mesenteries. It could be due to what thrombosis, which is here, right? So the lacerations is this one, or you could say tears, still the same thing. Right? Causes. What is the possible things that could cause mesenteric injuries or mesentery injuries? It could be blunt trauma like car accident or falls. It could be penetrating trauma like what gunshot or stabbing. It could be surgical complications like they did a surgery so they didn't actually do it well, so they touched the mesentery, right? It could be infections like what appendicitis, diverticulitis. It could be inflammatory conditions like Crohn's disease or ulcerative colitis. Okay, the symptoms. If a patient has an injury in the mesentery, what are the likely things that will come and tell you that, oh doctor, I'm having this problem, I'm having this problem, I'm having this problem? They'll complain about abdominal pain. They'll complain about nausea and vomiting. They'll complain that when they defecate, there's blood in the feces. They will also complain about what? When they vomit, there's blood in the vomit. Okay, so even if they don't tell you, where as you are taking the history of the patient, make sure that you ask all these questions, right? Then okay, when you try to palpate the abdomen will be tender, there'll be muscle guarding, there'll be rebound tenderness, right? Diagnosis, physical examination, that's where you are noting for all this what abdominal tenderness, then abdominal distension and all the stuff. Trying to see which part of the abdomen has the pain and all the stuff, right? That's physical examination. Then imaging studies to confirm. You might want to do things like CT scan, ultrasound. Then you can also do some laboratory tests to confirm to like complete blood count, electrolyte panel, exploratory or laparotomy. This is when exploratory laparotomy comes in when you are not able to get the right information you need. So you have to just open the patient up to see things for yourself, right? Treatments. You could do supportive care like fluid management because as there's injuries to the mesentery, it could be that fluid is not being absorbed much again, or probably there's bleeding, so there's loss of fluid. So fluid management, resuscitate the patient, pain control. All right. Surgical intervention include what? Mesenteric repair, bowel resection. Then endovascular interventions include what? Angiography, embolization. Then antibiotics is for what? Possible infections that could result. All right. Complications. If there is an injury to the mesentery and you leave this thing or you don't manage it well, it could lead to bowel ischemia. What is ischemia? the blood supply is cut off. Okay, it could lead to what? Inflammation of the peritoneum, which is what? Peritonitis. It could lead to abscess formation. It could lead to fistula formation, that's abnormal communication between two epithelial tissues. It could lead to what? Intestinal obstruction. It could lead to malabsorption. Okay, so I think this is everything about what? Mesenteric injuries or mesentery injuries. Definition, types, causes, symptoms, diagnosis down the line.